Yes.
Good evening, sir. We are live now.
Good evening, all. This is Chandra Mohan, physiotherapist. A warm welcome to all the registered participants and Fitness and Rehab India YouTube viewers and all our distinguished guests, volunteers, everyone, for the final episode of India's first ever free international e-conference, COVID conference, that is Covicon 2021, themed as during and post-COVID care. And today's topic is, final topic is, role of physiotherapy in COVID care, emerging evidence, will be taken by. Before I announce our resource person name, I would like to tell a small story. I don't know about our resource person. I called him and I told her, sir, I am Chandra Mohan and I am doing so and so job. And I have seen your name in guidelines. So he was so happy that is the moment I felt that if someone appreciate somebody's work, how it feels. Maybe if I have got somebody's appreciation, I could have felt the same. And he was so happy that thank you. I feel that is what we have done that has been reached. So somebody has appreciated it. And sir, I have seen the name in the list. That's why I approached, because I want you in, because you stalwarts have framed the guidelines for Indian physiotherapists so that we all can follow. And he was so happy. He was helping, giving topics and giving ideas. And he's the man behind that this conference is going international level. He suggested Mrs. Reshma Praveen. And thank you so much for that, sir. And now the resource person is none other than Professor Narasimman Swaminathan, Faculty of Allied Health Sciences, Sri Ramachandra Medical College and Research Institute, Chennai. I welcome you, sir, on behalf of EXRX India team, on behalf of all Indians, physiotherapists, and all other participants from different countries. I welcome you, Dr. Narasimhan, sir.
Good evening, all. Hope you all are safe at home, staying at home. First of all, I would like to congratulate Mr. Chandra Mohan and his team for organizing such a wonderful conference. This is the need of the hour. We may publish, one thing what we see, we may publish and we may create anything, but it should reach people. That's very important. So he has taken up this wonderful initiative. And last 2 days, I could log in and to some of the sessions and I could listen. Fantastic. That is how we will be able to change our profession. Knowledge is power. We know that. So if you share your knowledge, that's the power. So the profession can go to the next level. So congratulations, Chandra Mohan and his team, for this wonderful conference. And thank you very much for this opportunity to share the part which is least touched. That is what happening here also. This is kept as the last topic. But that is the difference between the developed countries and here. We never look into evidence. We think that whatever we know, that's correct. Yeah, of course, your expertise is very important. That's an important component. But to be a scientific field, we should have research evidence. We are looking into this Covaxin, whatever the COVID vaccines. Different vaccines coming out. Why people are not taking vaccines? People say there is no research. The research evidences are something different. So when it comes to you think of that. Okay, but now it is proved, it is effective. Now people are going for it. Similar way apply to any scientific profession, especially health professionals. That's what our WCPT is strongly, recommending. Everybody should practice. The practice should be based on evidence. It should be evidence informed. So this title is talk is about that, how we could translate the evidence and what are the emerging evidence. Of course, you hear from all the stalwarts, they share their experience. I, as a passionate evidence-based practitioner. I promote evidence-based practice. I believe if in our country, if we adopt evidence-based practice in physiotherapy, that will be one of the strong steps towards our professional autonomy. I strongly believe that. I could see that in my professional career. That's how we will be able to take the profession to the next step. So this talk is about that. The objective of this session is to discuss the guidelines which are available for physiotherapy in COVID care, especially the guidelines which come out from India. I'm not going to talk about the international guidelines, so people will think that that is not possible to have the international guidelines, may not be applicable here. So before going into that, just a brief introduction. This, as I told, this evidence-based practice is very important. There are important components of that. It's getting modified. This one, you should be able to understand this piece of work very clearly. You see that here, the clinical expertise, that's what a therapist bring in, the patient values and the circumstances, best research evidence, information from the practice context, where you are practicing. It is not that, whatever is published, and, the information from your practice context, where you are practicing. These are all the components of evidence-based practice. Evidence-based practice involves clinical reasoning to integrate information from these 4 resources. Your reasoning is the pillar. Nobody can take away that your reasoning skills and your physiotherapy skills, what we possess in practicing and delivering physiotherapy care. So this is important. I just thought I should set up a base, because EBP brings in transparency in practice. Anybody will practice the same. That is one big problem we face in our country, especially in physiotherapy. If you look into that, somebody practice something else. One therapist is using something, one therapist is using different one, and then it's not reaching anywhere. The transparency is not there. EBP improves quality of care. If we put evidence into practice, that definitely improves the quality of care. There is enough of supporting evidence for that. EBP is cost effective because we provide the best cost effective treatment to our clients. EBP involves patient preference as one of the important component of EBP. It provides patients opportunity to participate in the clinical decision making. EBP makes the clinical practitioner as a lifelong learner. What I learned in 1998 when I completed BPT, it may be outdated. But unfortunately, we are not updating because we are not practicing on EBP, so that the lifelong learning is not happening. So EBP is a tool. It will make you to be a lifelong practitioner or lifelong learner. One of the things what we observed, EBP, as I told you at the beginning, could be a first step towards reaching the professional autonomy. If you take the history of the professional development in the developed countries, especially physiotherapy, you will see how much they put evidence into practice. So there are various levels of evidence, starting from the low level. Ideas, editorials, opinions are the low level. Please understand that. Ideas, editorials, opinions are the low level. It's my opinion, it's my idea. Yes, it could be your idea, but the level of evidence, that's the low level. The hierarchy goes up. Case reports comes, case series, cohort, RCTs, systematic reviews and meta-analysis are the highest level. Understanding this is very important. So based on this systematic reviews and meta-analysis, clinical practice guidelines are created. That's the future. COVID definitely, created a lots of problem. It shattered everything. If we reflect, everybody is affected. Everybody affected. At this time, we should remember all the COVID warriors. They have done wonderful job. They are continue to doing. Happy to see that physiotherapists also play part of that, and we are playing a major role there in as a professional. That's a good way how we could give back to the society. So having said that, if you see, the guidelines are the one which are formulated based on the evidence. So as I told you, this COVID, the opportunities that made us also to think to come out with some of the national practice guidelines, like how other professionals are preparing. So what are clinical practice guidelines? For you to understand, before I'm discussing the guidelines, the clinical practice guidelines are systematically developed statements to assist the practitioner and patient decision about appropriate healthcare for specific clinical circumstances. But it requires, major studies. But current situation, we cannot wait till the, studies are coming out. We should look for the available evidence. At the same time, there the clinical expertise comes in, bringing the experts' opinion, considering the experts' opinion and their practice experience, and putting it and preparing a guidelines. So the guidelines are a convenient way. What it does, it packages the evidence and presents the recommendations to the healthcare decision maker. It's packages. It makes it very simple, like a spoon feed. It makes like a ready-made food, and that gives. But of course, we should keep it in mind. This is not taking your clinical reasoning or clinical expertise away. We should keep that in mind always. The guidance for best practice for diagnosis, risk assessment, treatment. For everything, we have guidance. It's a best evidence statement which targets the end user. Who is the targeted end user? Here, the clinician, the clinical therapist. We should understand the clinical practice guidelines are for our clinicians. It is not for the, the policy makers, or not for the people, academicians and researchers. People have the misconception, CPGs are only for those people. No. The end user, it is going to benefit the people, society, only if the clinical practitioners are aware of it. They should be able to put this into practice. So it is managing the right patient's right at the right time and place using the right guidance. I like this. My mentor, from University of South Australia, she always tells that, I learn evidence-based practice from her. She tells me that that's what, managing the right patient right at the right time and place using the right guidance. That's what we need. That's what healthcare is about. So the guideline development is there are, 4. You can develop a new development guideline, or you can adopt, you can contextualize, or you can adapt. I'll just tell you what is what. The tier 1 is the body of evidence. Then we have expert input and consultation process with the body of evidence. Finally, the end user guidance come up. It's a step. It's a step. Here, I would like to acknowledge the International Center for Allied Health Evidence for creating this and educating and training, especially in how we can create CPGs. This is important. The body of evidence comes in, then the expert input, and then it becomes an end user document. Either you can adopt, directly you take it, or contextualize, or adapt, modify. Adopt ACA model, what they proposed is an ACA model. Adapt is directly take it. Wherever it is available, take it. So when it comes to COVID guidelines, we will not be able to adopt directly because the healthcare system of the developed countries are totally different. Our healthcare delivery system is different. We will not be able to adopt. Of course, if it is similar situation, similar healthcare, we'll be able to adapt. The next is contextualize. The original product, take it and then add for your particular country. For our country, how much we will be able to add and what is needed and what can be used, that way. Then adapt is making a change. So this is how the guidelines are developed. So what happened? Coming back to the COVID, thanks to the team, Maria Madam, you listened to her in the morning. We could work together. We came out with the first guidelines, which was published in Indian Journal of Critical Care Medicine. So that was the first, guidelines we came out with for the acute management. Now what happened, this guidelines has been updated. What we prepared has been updated, contextualized, adapted by Indian Association of Physiotherapists. That is what the document which is available. That is one of the guidelines which came out. You all should refer for it for the national level. Probably, the first guideline for physiotherapists. So we have done lots of work on that. We adapted the scientific method. So based on the acute guidelines, what we prepared, when it comes to the patients with COVID symptoms, the acute, the mechanically ventilated and non-mechanically ventilated. As I told you, a big team we worked. Especially Maria Madam, Mr. Praveen from Qatar, Prof, all the team members. We met many days. We searched into the literatures and we came out with the guidelines. We consulted all the, if you see the guidelines member, all the therapists, those who are practicing in the ICUs were consulted. They gave their input so that it could be translated and you will be able to practice, as I told, the end user can be able to put it into practice. So mechanically ventilated, non-mechanically ventilated. When they are mechanically ventilated, the respiratory physiotherapy, this was prepared during the first COVID, first COVID wave. So respiratory physiotherapy, we need to limit the exposure. Now it is changed because of the the emerging evidence. Now it is changed. We do have a role there, especially when it comes to positioning. So there, if you see, if they are mechanically ventilated, our role is restricted to maintain the skeletal muscle properties and to initiate the mobilization. If you say this is again going back to the evidence-based practice in generally how we practice in ICUs. In ICUs, we assess, we reason out. If there is no indication, we will not start physio. You all know that. That is how again your expertise comes in. We are the judge. The judgment is done by the physiotherapists working in the ICUs. So this is all again a guidelines. So again, we classified when the patients with high flow oxygen, low flow oxygen, and room air, what has to be done. So this has been practiced. This is adapted from the other countries, and our therapists also, those who are practicing, they are using. So if you see this document, this provides a clear idea to a clinical therapist how they will be able to implement. Only thing you need to read, you should spend some time in reading it. Of course, the expertise is there. You all developed your expertise, and those who are practicing in the ICUs, you know what techniques to be used. So we are taking that for granted that you know the techniques, you are using the right technique. But this is a guidelines what could be done based on the evidence available. So what has been done? If you see that patients are classified into mild, moderate, severe. Mild patient, the oxygen saturation 90 to 94. They don't have any symptoms. The D-dimer value is less than 1. The HRCT severity less than 80. They are oxygen support either low flow or at room air. So what physiotherapy management is recommended is diaphragmatic breathing exercises. The respiratory rate should be less than 24. You could also prescribe incentive spirometer if required. Because if you look into the evidence from the developed countries, incentive spirometers are not having such effectiveness. But here, when we discussed with our therapists, those who practiced, they felt our patients were able to do the deep breathing if we provide incentive spirometer. That's what the contextualization comes in. You see what the situation. So that's the right example. Again, moderate. What happens in moderate clients, which is observed elsewhere, and our therapist, we also observed that the SpO2 drops during the activity. They have fever, cough, breathlessness. So the D-dimer value is more than 1. HRCT score 9 to 19. They are with high flow oxygen or venturi mask. So what is recommended? Proning. Again, airway clearance techniques only if they have retention of secretions. So what techniques? Go for active techniques, ACBD and FET. Again, for them also, diaphragmatic breathing exercise is important. So that is how we develop the guidelines. This is easy. You know, if you read this, the document, if you see the tabular column, you'll be able to identify that. When it comes to severe, you know, this is what our first guidelines, the acute guidelines. You'll refer this in the IAP document, also in our document which we published in Indian Journal of Critical Care Medicine. Also, you'll observe that. So high FiO2 and P to maintain oxygen. You see, they may have altered mental signs, and you know, they may have ARDS. Again, the D-dimer value, they may be mechanically ventilated, or they may be non-invasive. So there, active physio is only, you know, the proning, if required, close suctioning, and, you know, plan for early mobilization. You know, that's a, you know, that it's a step. Early mobilization means it's not just making them walk there directly. No, we know the steps, stepwise early mobilization. If they are critical, this is how they are classified. Only proning, close suctioning. You know, again, we plan for early mobilization if it is indicated. You know, that is your clinical judgment. You know, it's not that all patients, it's not that one size fits all. It is individual. That is what the therapist clinical reasoning is coming. So, patients who will benefit from respiratory physiotherapy in the acute care, if you see that, if they need increased supplemental oxygen, increased need of supplemental oxygen, please, your decision making is important. Assess if you identify they require increased, you know, supplemental oxygen, then physiotherapy may play a role. How? By reducing the oxygen demand, positioning, controlling the breathing, reducing the work of breathing. Physio is indicated only if they have copious secretions. Again, which airway clearance to be used? Your judgment. Passive techniques seems to be not effective. You know, even our therapist mentioned that there are a couple of papers. I'll show you the papers which are emerging evidence, which says, again, that is what we also came out. Percussion vibration, use very judiciously. It is not at all required. You know, we could see lots of viral videos. Please be evidence-based practitioner. If you are from yesterday, all the experts were talking. You know, they explained very clearly when you need percussion vibration. Please don't misunderstand. Chest physiotherapy means providing clapping vibration. Chest physiotherapy is more than that. So that is what here I would like to stress on that. That's what the evidence also says. Those who have retention of secretions with weak cough, yes, our ACBD or active techniques, positioning, if required, again, if required, PD will help, postural drainage will help. If they have inadequate ventilation, yes, we are there to improve the ventilation. So if you identify the patient saturation improves by positioning or decreases by mobilizing, yes, we have a role. Observe that. That is what a case series which is published recently, which explains. So if they have decreased functional capacity, yes. So to identify these points, physiotherapy assessment is important. That's what I said, the clinical expertise. Nobody can take away your expertise. How good we are in assessing, how good we are in reasoning out. So who will not benefit from physiotherapy? This again from the evidence which was published by the other countries and some of the case series, as well as our therapists when we identified within the group. Patients with ARDS with respiratory rate more than 30 beats per minute, they're not going to be benefit. Most, you know, they unlikely. If the SpO2 is less than 90% despite oxygen support, with a FiO2 of more than 50% on a non-invasive mechanical ventilator, you know, they may not benefit. You know, only the positioning. You know, of course, the maintaining ROM, we don't know have any evidence. Even a judgment. You know, the clinical judgment is important. That's how the evidence-based practice comes in. So here you are prioritizing where you can help, where we cannot help, so that we can focus on the patients, those who require physiotherapy. So in acute phase, in severe respiratory conditions, respiratory physiotherapy is to promote and to reduce dyspnea. That is what important. When we reduce work of breathing, we are reducing the oxygen demand. We know that physiologically. We are reducing the oxygen demand. If required, we should focus on tracheobronchial clearance. If required, again, if required. So that is what the evidence which we identified, we discussed among our Indian physiotherapists, those who are practicing also. Here, the role of physiotherapy is to promote oxygenation. That's what important, you know. By providing appropriate physiotherapy, we will be able to, again, sorry to say we may be able to reduce the oxygenation, because we need to have the evidence. So when I talk about evidence, please document. Whatever treatment you are giving, please document. I hope you might have listened some of the sessions yesterday. You know, one of the international speaker was mentioning how they consulted the case published evidence, how they use that into the practice. That's a real practice. That is what we need to move towards. So again, the strengthening the skeletal muscles. So what has been put? Acute stage, airway clearance techniques not advised, or not advised if there is no indication. Please keep that in mind. If the patient is not having retention of secretions, you know, again, I quote, I just, that video was viral. You know, you all might have observed that, you know, giving percussion, you know, that's not going to be useful. That's what the evidence says. So breathing exercises, yes, seems to be effective based on the preliminary evidence and our therapist experience. Yes, of course, you know, a couple of patients we could also observe in our setup. So when we provide deep breathing exercises, you know the benefits. But here, one point, please follow the principles of deep breathing exercise. Again, we could see some of the YouTube videos which were published by, posted by our physiotherapist. You know, yeah, some of the videos are excellent, but some of the videos didn't follow the principles of breathing exercises. Please keep that in mind. There are certain principles to be followed while prescribing the breathing exercises to be effective. To be effective. That's what, look for the evidence, how a breathing exercise has to be given. So if it is prescribed, if it is practiced in a way it has to be practiced, it is effective. You know, the principles, the positioning, your tactile stimulus, your vocal stimulus, you know, the command, how you are giving, those things are very important. Where you are placing your hand, what instructions you are giving, those things are important. Airway clearance technique, you know, only if it is indicated. Only if it is indicated. Only if the patient has copious sputum, thick secretions, then go for percussion vibration. Otherwise, please don't do percussion vibration, because, you know, it may increase the bronchospasm. You know, there may be adverse effect. So don't provide percussion vibration. That's the point I would like to stress here. So what happens? What the emerging evidence, you know, before going into the next step? You know, this is one of the systematic review which attracted our attention. You know, we are keep updating our guidelines. We are looking into the evidence, you know, emerging evidence. Whenever it published every week, we look into that. You know, this is one thing, you know, attracted, you know, it published recently. You know, there is a systematic review. Of course, the quality of the articles which included is not high standard, but they identified what are all the symptoms, you know, that made us to think where we have a role. Of course, you know, the loss of taste, anosmia, cough, chest pain, tightness, dyspnea, fatigue, sleep disturbance, and headache. These are all the symptoms, you know, based on this systematic review. You know, this included many studies. Of course, the quality of studies are not good. Heterogeneity is more. This is across the globe. If you see the symptoms, we have a role, major role. Of course, if the cough is due to retention of secretions, we have a role. That's what I say. Physiotherapist's role is going to be stronger in post-COVID rehab, you know, recovery. in support of recovery. Dyspnea, yes. If the reason for dyspnea, we need to identify. There are various reasons. What is the reason for dyspnea? In most of the causes, we as a physiotherapist will play a major role. So in case, if the inspiratory muscle strength is less, yes, we have a role in strengthening the inspiratory muscles. You know that. If the dyspnea is because of decreased functional capacity, yes, we are the movement experts in the healthcare team. How are we going to prescribe the exercises? So that's what our role is strong. That's emerging. You know, these are all the papers which tells, get ready. You will be able to help the clients. We have a stronger role. Fatigue. That's a big problem. You know, most of the speakers touched upon that. So we have a major role in preventing the fatigue. But to go for that, we need to know how we are going to assess. We should strengthen our skills in that. We should be ready for that. You know, this is another interesting study, which is again the recent publication. You know, of course, the number is less. Only 32 critically ill COVID patients. They measured the ultrasound of the rectus femoris and anterior compartment of thigh muscles. You know, first day and the 10th day, the patient, those who are critically ill, you know what they observed? There was significant reduction in the cross-sectional area. Ultrasound showed significant reduction in the muscle mass. That's a point to think of. You know, the papers are coming up. That tells, yes, we are going to have a major role. You know, documentation is needed. You know, once the documents are coming out, we'll be able to, look where we will. This is another point where we can, wander out. This is another, case series which is published from, Singapore in physiotherapy. The clinical course of physiotherapy intervention in 9 patients with COVID-19. So what they found, it's a 9 patients. Again, case series is a low-level evidence. They found respiratory physiotherapy were not indicated for them, according to them. But they found physiotherapy was useful if the patient had exertional or positional related desaturation. They meant respiratory physiotherapy means postural drainage, percussion, vibration. But when the patient required exertional and positional related desaturation, this seems to be effective there. That is what they found with a minimal number, 9 patients. Of course, our case series are getting up. We will be able to see some of the papers which is published from our country also. It's coming up. We are there to get some of the papers from our city. So I'm not going into the much detail. So these are some of the evidence. There's another review which catched my eyes. Recent published. This long COVID. Of course, long COVID is that role where we have a major role. If you see this, the personalized rehabilitation seems to be effective in preventing long COVID. That's what this review says. Of course, reviews are a narrative review. Again, it's kind of expert opinion. This says, personalized rehabilitation may prevent long COVID, but long COVID can affect the cardiology, pulmonary, neurology. We had a session. One of the speakers explained how the other systems are involved. So physiotherapy is going to play a major role here. That's what the emerging evidence says. So we should equip ourselves. We should equip ourselves. So what can we do after COVID? Again, this is one of our guidelines to be published in December 2020. This was again updated and contextualized by Indian Association of Physiotherapy. There are 2 guidelines now out. So this we published in Journal of Association of Physicians of India. You'll see that the same team, most of them are working in ICUs, and they also, what we have done, we did an extensive search during that time. We searched the database and we also looked into the studies and the guidelines. We classified the quality of evidence. This is what again adapted by IAP and modified, updated. So the evidence we classified. You see the 1, 2, 3 we graded. If there is no evidence, we took that the universal practice point, how the clinical expertise they are working. And we also gave with a recommendation A and B, strong recommendation and weak recommendation. That is there available in the IAP guidelines also. So again, we classify the patients into severe, moderate, mild. The mild patients are asymptomatic, with dyspnea scale. We try to classify by using the MRC dyspnea scale, which is commonly used. Those who require, we provided the guidelines. This table summarizes. If patients with severe, moderate, minimal impairment, if you see the severe impairment, start with the goal should be reduce work of breathing. Select the technique which is appropriate. You know that, partially breathing, breathing control, breathing exercises. That's your clinical expertise. That's what I say. The clinical expertise is important. That's what the guideline says. Retraining of breathing is important. Reduce external oxygen support. If there is, that should be our goal. We use positioning. We use, whenever it is required, the airway clearance. That's how we plan. This table explains how we proceed further. To improve the respiratory muscle function, you'll see there, if patients with minimal impairment and moderate impairment, you can consider the inspiratory muscle training, the threshold device, if the patient is affordable, because there are a couple of case series which says the threshold devices are helpful in improving the respiratory muscle strength in post-COVID patients. So if you are expert in that, if you are able to use that, please consider that. That's how we are putting evidence into practice there. For every patient, the cardiorespiratory conditioning is important. Your exercise prescription comes in. That's what the pulmonary rehabilitation comes in. We promote health behavior. Yes. We need to minimize the adequate ventilation and, maximize the ventilation and oxygen. All your breathing, our breathing techniques, what we use will be useful over there. So that is how the guidelines are developed. So the questions to be asked, though we are putting into evidence, there are emerging evidence. First, consider, is there a pathophysiological rationale for the use of therapy? When it comes to COVID, yes, we do have strong pathophysiological reason because it affects the lungs, it affects the vascular system. We know the pathophysiology we discussed. You know that. There is a strong reason. Will the patient benefit from physiotherapy? Ask this question. It's not on all the patients, but here majority of the patients are going to benefit from physiotherapy. That's what the emerging evidence says. Very important. Consider, is there potential adverse effects? Since it is not documented, we don't know what is the potential adverse effect. When we looked into the paper and we discussed, when we analyzed, the problem comes with percussion vibration, very cautiously to be used. Except that, yes, the breathing exercises and other things seems to be safe. But we don't know whether postural drainage and percussion vibration produces any deleterious effect. There is no document, but there is no positive effect. That is what that point comes in there. So then look of which therapy is likely to provide the great benefit with least harm. Keep these questions in mind in your clinical decision making. Please consult the evidence. Your expertise is the core. Nobody takes away. People think that consulting evidence is a desktop research and comes back. No. That is important because the research evidence, implementing research evidence will only take us to the next level. So that is what, again, that comes back the first slide. Evidence-based practice involves your clinical expertise, consulting the research evidence. These pieces. What is your practice? So thank you all for your patience listening. Once again, again, I would like to acknowledge the guidelines team, all involved. We had a wonderful, interactions and sessions, both IAP as well as our guidelines, what we published. So it came out well. Now we are looking into the emerging evidence also. We are updating it. We are able to put that into practice. Thanks to the organizers once again. Over to you, Chandramohan.
Thank you, sir. Thank you so much. When you say through phone that I'm going to talk only for 20 minutes, I was a little worried. But thank you, sir. Thank you for giving so much of information.
No, the flow took me to another 10 minutes. Hope I didn't exceed the time.
No, sir. I welcome it actually. I welcome it because all the points you said are most important. That I realized what you said, that evidence should be first part, and I noted it. I will not do the same mistake next time, that I will keep evidence topic in the first. And thank you for teaching us about components of evidence-based practice, and reasoning is the pillar, and highlighting right time and right guidance. And your speech is the right guidance at this right time, because you tracked even the viral videos inside. You cared for that because it is harming for the public. So you gave the right guidance at the right time too. And thanks for sharing uh, Maria Madam's article also, that shows that you have a good heart to share the peer group's article and taking points from that. You have a really good heart, sir. And also explaining that one size does not fit all. Yes, every physiotherapist should make individual patient protocols. And also role of PT, you have stressed that it is increase, it should be to increase O2 saturation. And when you are getting something good, document it. That, and you explained the importance of documentation also. And airway clearance are not advised. You clearly told that. Okay, and it is indicated only if needed. Otherwise, it leads to bronchospasm. And you told us to follow the principles of breathing exercises, that is like positioning, vocal stimulus, tactile stimulus, placement of hands, what else, everything. And thanks for that. And respiratory physiotherapy is not indicated, but how physiotherapy was useful when there is a desaturation. You showed us the evidence also. Thank you for that. And you gave the acute post-COVID symptoms, and you explained it detailedly, and how much physiotherapy role is preventing the fatigue. That also wonderful, sir. Thanks for that information. And how physiotherapy has a major role in long COVID. And also you shared your own article which was published. That was so nice. Only the resource person who talks about his own article can deliver more than 100% regarding it. And thanks for that. And you have given us the physiotherapy recommendations for post-COVID care, especially for severe, moderate, and minimal impairment COVID patients. And again, coming back, that you are stressing that percussion and vibration, it does not have any positive effect. And thank you for that wonderful information, sir. We will move on to question and answer session, and over to Dr. Rupesh. Rupesh there, madam?
Yes, sir. Thank you for such a wonderful session, sir. Am I audible, sir?
Yeah, yes.
Yes,
Yes,
you.
Yeah, we'll go with the first question from Yongjing King. You are saying there are some techniques not done correctly of breathing exercise. May I know what is the correct way of diaphragmatic breathing exercise?
Yeah, there are certain principles to be followed in diaphragmatic breathing exercise. We all know that as a physiotherapist, the basic technique, first thing is positioning comes in very important. We need to put the diaphragm in a advantageous position. That is what we say, the posterior pelvic tilt. It's a simple principle what we follow. And then the tactile stimulus, how we place our hand and how we give the command, the vocal, the verbal command. You will be able to control. That's what our professors taught us. You will be able to control the breathing depth of the client. When you say breathe in, that's different. When you say breathe in, I hope you understand that. Same way, you control that. Breathe out. This is very important. That's how our professors taught us. Till today, we are practicing that. This simple technique, the principles has to be followed. It's published in various papers also. If these principles are not followed, the effective may not be what is expected. As the effect may not be as expected.
Yes, sir. Thank you. Next question is from Ms. Purnima. What is the mechanism behind reduction of vitals while performing diaphragmatic breathing exercise if respiratory is more than 24?
Mechanism?
Mechanism behind reduction of vitals.
Yeah, it's
Why
of course
the-
when you control breathing. So breathing controls everything. You know, when you go for a controlled breathing, you are reducing your respiratory rate automatically, and then it also reduces the blood pressure. Also, there are a couple of good research which shows. Because it is acting as a whole. It goes to the physiological system and it controls everything. Tend to relax. That's what we call the relaxed breathing.
Hope so, sir. Yes, I guess, sir. It's from the YouTube viewer.
You can
Yeah.
request the person to rephrase the question again, and there is an announcement for the participants. Kindly put your registration number and name, and volunteers are requested to join our Zoom meeting. Yes, please carry on.
Yes, sir. The next question is from Ms. Baby LRK. What does the word clinically donates holistically in research field, sir?
What is it? Clinically?
Denotes holistically. What does the word clinical denotes holistically in research field?
Meaning is, sir, they are asking what is a holistic approach?
Holistic is a whole. As a whole, you should consider all the components. You should have everything into the picture. When you take a clinical decision, consider all holistically. Every aspect needs to be considered. It's not only focusing on one area.
Yes, sir. Next question is from Physio. Sumita Adav. Sometimes doctor recommend physiotherapy when patient has dry cough. What do you suggest, sir?
So what is the reason for the dry cough? Why that recommendation? Why the doctor is referred? There comes another concept of our interprofessional relationship. Why can't we go and talk to the consultant? We did that, in our early career. Now also, whenever there is nothing wrong in going and talking to them, what you are expecting? Why this is referred? What is, of course, your assessment, you will be able to identify whether the patient requires physiotherapy or not. Still, if the doctor insists, still the physician insists, ask them what they are expecting.
Yes, sir. Thank you. Next question is from Ms. Manimegala. How many RCTs have done for physiotherapy role in COVID till now? Any guess, sir?
No, till I think 3 days back, there are protocols published, but no RCT is published as per my knowledge.
Fine, sir. Next is from Dr. Vishnu. Can we prescribe FET in case of mild to moderate COVID?
If the patient has secretions, yes. See, that's what I told. If there is indication, then we need to prescribe the airway clearance. So FET can be prescribed if you feel, if there is a retention of secretions that affects, see, even in airway clearance technique, we know that only we will prescribe if it is indicated. Every day you will also have some mucus secretions. Will you prescribe airway clearance daily? No, only if it is indicated. That is what important. See, the reasoning, the clinical decision making is important. It's not that every client I will go and give. No, if they require, yes. If there is a retention of secretions, if that secretion affects the respiratory function physiologically, then indicated. If they're not able to remove without any assistance, yes, then it is indicated.
Fine, sir. Thank you. Next, we'll go with Mr. Manigandan. Sir, where can we get updated evidences for physiotherapy interventions as the disease changing its course?
See, the guidelines are getting updated. You see that the living guidelines, they say, every month or every 2 months they get. Now that the trend is changed, they get updated every time. You can go to the Google and you can put it in guidelines. You'll get every month it is getting changed. They call that living guidelines. It's getting updated. Even the rapid systematic reviews, rapid guidelines are getting updated regularly. So even our guidelines, we will be updating. We should update. It's time for us to update. Yeah, because it was published some time back. It's time for us to get updated.
Okay. Yes, sir. Next is from Ms. Smita. sometimes breathing exercises stimulates coughing reflex. Should we still continue exercises?
If any adverse, if you are, according to me, if it is, again, I didn't look for any evidence. If I practice, if it is stimulating cough, why it is stimulating cough, then if it is producing any disturbances, I think I will stop that technique.
Yes, sir.
I'll wait for it to, resolve and then go for it.
Fine, sir. We'll go with one last question from Ms. Bhavi. Sir, then for whom we are supposed to give percussion, like respiratory techniques, post-COVID patients?
See, percussion vibration, you see, even in generally, if the patient has thick, copious sputum, percussion vibration is indicated. If that is affecting, again, if you give percussion vibration without postural drainage position, it is not effective. Please understand. I see some of the videos, people make the client sit on the chair and, give percussion vibration. See the principle. Percussion vibration is a component of postural drainage therapy. You position the patient in such a way, the gravity assist, and then provide percussion, provided if the secretions are thick. The secretions are thick, you are helping it to mobilize. Especially the thick secretions, bronchiectasis, lung abscess, those are all the clients we used to give. But here, if you see that secretions are thick, yes, but why percussion vibration if you're not able to clear without the active technique? Again, percussion vibration is performed in postural drainage position. Keep that in mind. That's what our teachers thought. That's what the evidence also says.
Fine, sir. Thanks for your detailed explanations. Now over to Dr. Chandramohan, sir.
Thank you, Dr. Mukesh, for handling the question and answer session smoothly. And thank you, Professor Narasimhan, sir. Before I summarize the whole conference in front of all the guests, Vita Ravindra madam to come forward because she's having some meeting. So I call her. I welcome her again as a guest. And madam.
Yep.
Yes, madam. We want to hear from you. All the sessions are over, and I want your words, madam, for the community.
At the outset, it's an extremely I would say a well-organized effort on behalf of you and your team, and it needs a lot of planning. It needs a lot of execution to get into something like what you all have done over the last 2 days. By and large, you've kept your timelines, and I am sure that the extent of contribution from the various experts would have been extremely encouraging to the physiotherapy community at large, because I was listening to a lot of questions that people were asking. So obviously they were there most of the time, and that's the critical part of it. Really acknowledging your tireless efforts, and thank you for having me out there to share with you some of my experiences.
Thank you, madam. Just because of you only, many of the things have framed properly, and how I don't know about what seriousness behind the conference. When we are first talking through the meetings only, I got a picture how a conference should be, how it has to be organized, and everything put their ideas, and it became. And thank you for being with us, madam.
You're welcome.
And thank you for those encouraging words. We will cherish this always, and we will remember this day always, because all our resource persons are the stalwarts, experts, and they are all prides of our nation. So we will remember this moment ever actually. Thank you. Thank you, madam.
Good luck. Good luck.
Thank you, madam. So with all distinguished guests being here, present here, I take an opportunity to say one thing, that before summarizing the conference details, and very first I told that I spoke to a renowned physiotherapist, but he didn't accept to take even a single topic because he was so busy. He has taken a lot of projects on his hand, So he couldn't find time to give a topic, but he helped me a lot in making flyers and selecting the right words and everything, lot of things. Every day I was in touch with him, and I was touch with Professor Narasimman sir and Dr. Annamalai sir too. So now I would like to tell the name of the person. He is none other than Dr. Prem Venkateshan. He is from working in Manipal Hospital. He belongs to Vellore, Tamil Nadu. Now he is in Karnataka, and he only told that 1 hour talk is not enough, so it needs 7 or 8 hours. That's how this conference has come. He free, then I am in, and we are always welcome. We have done a lot of free webinars. So we are not running behind the money. So we said, sir, I'm double happy now. So then started, he gave a list of topics. Then I shared with the other resource persons, and they gave some ideas. Every changes came, and boom, in a short notice, everything has happened smoothly. And before I summarize, I thank all the volunteers. The name will be announced later. And on first topic, myths and facts about COVID. Dr. Annamalai gave few valid points like difference between the first and second wave. And the golden key during this pandemic is the prone positioning and whom to consult before taking vaccination. Then came Mrs. Reshma Praveen from Qatar in the topic physiotherapy in mild and moderate COVID patients. What experience starters? She shared her success stories beautifully, and she taught us sequence of exercise prescription, when to do what. And then third topic, Dr. Bhaskar and Chandrasekharan came, drug interactions and exercises. He shared knowledge about immediate post-vaccination shock, oxygen pulse, effects of corticosteroids, beta blockers, and anticoagulants. And yesterday evening, we had the fourth session as the first session. Dr. T. Sendil Kumar spoke about detailed manner about COVID patients with comorbidities. He elaborated classification of management, post-intensive care syndrome, phases of exercise training. Yes, sir. Narasimhan sir is sending a message. Yes, sir. Within next 10 minutes, we will be also finishing. Thanks for joining with us, sir. Thanks for the wonderful knowledge sharing, sir. And thanks for all the help you have, all the support you have done. Anytime I have called you and you have responded very well. Thank you so much for all the support. And really, I will cherish this moment ever, sir. Thank you, sir.
Thank you. Thank you very much.
Yes, sir. And yesterday's last session was a critical care physiotherapist perspective and management of severe COVID, taken by one of my friend, Dr. Sankar Ganesh. He gave information and about intervention which are not recommended following physiotherapy. And he spoke very well about neuro-PNF and non-rebreathing bag and outcomes, physiotherapy outcomes, especially pulmonary outcomes and physical function outcomes. Then today's first session was taken by Dr. Maria, acknowledged of frontliners. That was beautiful moment that every frontliners need appreciation, and she acknowledged, and she shared success stories, and Madam explains stages of infection and new comorbidities and viral pathology and risk of malnutrition. And the seventh topic before lunch was taken by senior most physiotherapist, Dr. Savita Ravindra Madam, and she stressed that physiotherapists should not stay away as a musculoskeletal therapist, a neuro, biomechanic, OBG. Everybody has the role actually. Everybody should come forward to treat, that you should not sit at home or should not say that I don't know how to treat COVID patients or post-COVID patients. So everyone should upgrade their knowledge and upgrade their skills and be the part of the task force. And she explained beautifully about the guidelines, which was useful, which will be useful even in the clinic or even at home. And she recommended to buy costly equipment like thermometer and that saturation meter, that one oximeter. So they are very feasible, and we can buy it. So we can carry it to home, and also we can keep it at our clinic. So then came Rajisha Madam, and she is also one of my best friend, and she also follows EXRX India from the very first, very good supporter of us. And she shared her experience of treating pregnant mother who underwent LSCS, and also how they have progressed, and as how she treated as the same person as a pregnant woman and as a mother. Beautifully, she took the assessment along with the case discussion. And today, post lunch, we had Dr. Dr. Arun Maya, and he gave information about major 5 criteria for the diagnosis of critical illness syndrome, and he explained beautifully about exercise tolerance. And lastly, we had Narasimman sir, and we all are here what he gave the information mainly about emerging evidence that components and right time and right guidance, and avoid percussion and vibration because it doesn't have a positive effect, and it has indication. If indicated, then go. Otherwise, it leads to bronchospasm. And he spoke about the viral videos also. The videos may be viral. Sometimes it becomes viral because they are wrong techniques. So next time when you make a videos, follow the principles of breathing exercises and make a better videos so that we will not harm the public. And now I request James sir to come forward. I think he's here. Sir Prem sir, please. Dr. Prem Venkatesan.
Prem sir is there in the meeting. Sir,
Okay,
can you
okay,
unmute,
maybe.
please? Yes, yes.
Yeah,
please.
yeah. Yeah, good evening all.
Good evening,
sir.
sir. We are EXRX India. Thanks you a lot for all the cooperation and support you have rendered, sir.
Thank you. Thank you, Chandramohan, for all the planning and executing in a short time. Also, all the speakers responded really well, and I think this turned out really a good conference, and it's really a way forward. And thanks for all the effort for the whole team.
Thank you, sir. All because of simple phone call that ignited into a major conference, and India's first ever international e-conference, that too free. Thank you, sir. Thank you. Thank you for suggesting to go for free also.
Thanks, Chandramohan. Thank you.
And Rupesh, is the certificates ready for volunteers? Because this, I take a moment for thanking the volunteers. There are more than 15 members, and without them, we could have been so much tense. Though we have electronical attendance, actually, we have downloaded it from YouTube also. To cross-check, we may missed something, maybe at the end. Maybe after we have downloaded it, somebody have given attendance. So we had volunteers, more than 15 members. So participants are 1,200. So we have separated 100 members for one volunteer, and another 500 each. And last person who got 200 plus, that is around 300. And apart from that, we have one member to follow all the 1,200 plus members. So they beautifully worked without delay. Even immediately after the session, they sent the attendance, and thank you for that. And they are all Indians. I would like to talk about one person who volunteered and from other countries. Her name is Miss Hiba. I thank you, Hiba, especially because there is a time difference from India and other countries. Thanks for coming forward.
Yes, she is here.
Yes.
Oh, thank you. I appreciate that I joined you all, and I'm very happy to help you, and I'm ready again, and I'm ready to hello. I'm ready to help you again.
Yeah, that shows that your help doesn't stop there. That it show you are a representative here. That that you are representing your country, even as a volunteer. And I salute for that. And she's from Lebanon, and she volunteered. She didn't mind about the time difference, and she kept on messaging, when is the next session? What is the time difference? And
Yeah.
she helped.
Yeah, I
Thank
like
you so much.
I like attend webinars with you.
Yeah,
It
thank you.
was
Thank
very
you.
helpful. Thank you.
Yes. Is the certificates ready?
Rupesh, have you got the volunteer certificates?
Yes, sir. Yes, sir.
Kindly
Can you
release the
share
certificate for
volunteer Heba's certificate
Hiba
first?
certificate first. In front of all the distinguished guests, I Team EXRX India gives a volunteer certificate for Hiba just to appreciate her work and
Thank you. Thank you so
representing
much.
her country from Lebanon. Thank you so much. Please share the certificate.
Yes.
Yes, sir.
Miss Heba, what is the time right now there?
Now it's 3 and 40 p.m.
Oh,
I guess
3:40
there
PM.
is 3 hours between us.
okay.
Puna ma'am, can you share it? Share screen is not.
Okay. I am allowing it.
Okay.
No, it is allowed. Okay, just kindly wait for a moment.
Okay. Meantime, I would like to invite Dr. Arun Balasubramanian, who is senior most physiotherapist, presently working in Erode General Hospital headquarters and formerly Principal KG College of Physiotherapy. Arun sir, please come on cam. Are you there, sir? Yes, you are there. I can see you. Yes, madam. Maria, madam. Then next. Arun sir.
Thank you.
Yes, sir. Please, sir.
Thank you, Chandramohan, for inviting me. And I was not able to attend all the sessions, but I have attended a few sessions, but it was really, really valuable. Like yesterday, I have attended Shankar Ganesh session, and today I was attending Maria Jirani session. I was mostly attending on the YouTube because I was able to carry my phone and I can sit and watch. Whereas for the Zoom class, I have to connect the laptop since my mobile is not good support for the Zoom class. So I'm mostly like a mute listener of all these classes. I was really excited to watch that, and it was really very happy that I was also contributed few things in this first ever COVID conference related to the COVID, and I hope the students who attended would have got lot of knowledge, lot of input from various stalwarts in the physiotherapy, especially on the cardiopulmonary physiotherapy, who are not only the teachers but also they have lot of hands-on experiences. I can see their slides. I can visualize that when they speak about the methods, the techniques, the answers, everything. It shows that the experiences, what they are since from the last year. It's almost 1 year over, or like 1.5 years over. They are exposed in the corona situation, and they have did excellent in COVID physiotherapy care. And they are going to, I think most of the researchers or most of the speakers are going to publish the articles, and we are going to have lot of articles related to the COVID. I congratulate the whole team for their great effort. Thank you, Chandramohan, and the whole EXRX team. Thank you very much.
Thank you, sir. Thank you, sir. Can you, Rupesh, can you share the next volunteer certificate? Just go on. We can.
Yeah, sir. Duna ma'am, are you?
Actually, it is time taking here because my net is not that much,
Okay, I will
working.
share it, ma'am.
Yeah.
But I am ready with the RP certificates.
Yeah. Okay. Okay. Good. So here we call upon Miss Subia Nas. Please come on, cam. And here is your volunteer certificate. Thanks for helping us during these 2 days. Are you there?
Yes, she is there.
Yes, sir.
Yeah. So kindly accept the volunteer certificate.
Thank you, sir. Thank you so much.
Yes. Thank you. And I request Maria, madam, please. Maria, madam. Hello. Yes, Maria Madam.
Yes, we can hear
Yeah,
you.
yes.
Yeah, Maria ma'am is there. Yes.
Yeah,
Ma'am,
Madam,
kindly unmute, please.
unmute, unmute.
Hello.
Yes, we
Yes,
can hear
Madam.
you.
Warm welcome, Madam. Good evening once again. And successfully and smoothly, we have completed all the 10 topics. Thank you so much for your contribution because only such stalwarts can express in a simple way so that all physiotherapists can understand easily. So,
I just want to thank all of you and all your volunteers, each and every one of you, and you all have been very nice, very well coordinated, very well organized, on time, and the 2 days were very, very informative from all I could, I used to attend in between whenever I could attend,
yes.
whatever. And I think there was a lot of take home messages for everyone out there, and you did a wonderful job, and I really congratulate you for that. And most important is you're very humble. So just keep that, and I'm sure success will always be there with you. And I really like the way you approached and you speak to people and talk and persuade them and do that. Because initially I was not sure what I was going in for, but I'm very glad I was a part of the conference. So thank you very much and all the best. And I wish all the success. And again, thank you to all the volunteers, very nicely managed, very nicely managed. Yeah. Thank you. I'll take leave because they just need to move out for some work.
That's why I have immediately called you after seeing your message. Thank you so much for being part of this, Madam. Actually, we became famous because all of our resource persons, because you are all the pride of nation who made the protocols for treating patients through physiotherapy treatment. Thank you so much, Madam. And Rupesh, can you go for the next volunteer certificate? Meantime, I will check guest list.
Reshma madam there, Senthil sir, and Arun sir is there.
Dr. Shiny White.
Shiny White there? Not joined, sir.
Okay, go for the next one. Dr. Shiny White, here is your certificate. We will be sending it to you.
Rupesh, kindly go for the next one.
Akshata is there, sir.
Pardon?
Yes. Akshata is there. You can go, alphabetically. As in Zoom, we can see.
Akshata Sindhu?
Yes, she is on cam.
Yes,
yeah.
sir.
Yes, kindly accept your...
Kindly share her certificate, Rupesh.
Yeah, ma'am.
Dear distinguished guests, it will take some 5 or 6 minutes only. We are having 10 volunteers, 10 to 15 volunteers. Kindly bear with us. Because of them only, we were so cool to do our work. That's why we are giving priority to them. They were like, they made us cool for these 2 days. We were not in attention even a single second. And on
it's
time.
So nice to see their happy faces.
Yes. That's why.
Rupesh, it is shiny certificate visible. Kindly show Akshata's.
Vishnu Priya Bhatt.
Akshata's you have not shared yet.
Tanishka Gupta.
Yeah, go along with the certificate wise, no problem.
Yeah, it is for you, Akshata.
Yes. Akshada, kindly accept the certificate, please.
Thank you so much, sir. I really enjoyed this conference. It was really very, very much informative. Thank you, sir.
Thank you for helping us. And
Rupesh, go on for the next, please.
meantime, I would like to request Reshma madam, please join with us to camp, madam. Yes, unmute your mic, please. Unmute.
You can hear me now?
Yes, ma'am. Yes.
Congratulations to all volunteers. Very well done job. Very, very well done. Very well organized. It was a wonderful experience. I may not have heard all the talks, but I followed them up on YouTube. So great job done. Great job. Because normally, if you have an e-conference, you have a lot of hiccups with the streaming and all these things. But damn good. Congratulations. Keep it up.
Yeah, thank you, madam. Thank you so much. Though there was a local time difference, you also came at the right time. You have joined early and stayed with us and following with us. It made us so cool, actually.
My pleasure. Thank you. It's my
Thank you
pleasure.
so much for being good-hearted. So you didn't make us to tense. That is the major
Thank
point
you.
here noted. Yes.
It's my privilege to speak with such esteemed panel. So I couldn't have asked for anything better than this. Thank you.
Yes, madam. And because of experience, we already had 24 topics in a single day. That was managed. So this 10 topic was so easy for us, especially when Duna madam is there.
Well done. Well done. Well done, all
Thank
of you.
you, ma'am.
Yeah, thank you. Thank you so much.
Thank you.
Yes, madam. Rupesh, is next volunteer certificate ready? And thank you, Simran, for designing a volunteer certificate in a different way. And I'm waiting for RP certificate to see. Very nice. I call upon Miss Vishnupriya Pati.
Is she there? Vishnupriya, you there? Yes, she's there in the meeting.
Yeah, hello. First I want to give a very big round of applause to Chandramohan sir. And actually, I want to congratulate you, please, sir. Because the thing is, nowadays, whoever are arranging so many kind of webinars or e-conference, nobody will be, your thinking level is like this. So some will be in the ground level, but exactly, I guess this was a very informative class, because even as a physio, even I'm also working in hospital setup. And the thing is, I want to tell one more thing, because I'm also COVID positive. I'm in home isolation. Actually, Chandramohan sir knows this. Yesterday only I told. So exactly, I sometimes we will be hesitating to ask our seniors. So basically it happens in hospital setups. They'll be telling, yeah, do this, do that, and I guess this was very informative. Once again, I want to congratulate Chandramohan sir, Juna ma'am, and Rupesh sir. Exactly, it was a wonderful success.
Thank you. Thank you so much for your appreciation. And also, I told you that you listen to the session. I can make some other volunteers, but you came forward that you can handle both. You will take attendance and also you will attend. Hope this will this conference might have helped you personally, and also in future also you will do better. Kindly accept our certificate.
Exactly, sir. It was.
Yeah, thank you.
Thank you so much, sir.
Thank you so much. I call upon among our distinguished guest, Dr. Sendil Kumar sir, please. Sendil Kumar sir. Dr. T. Sendil Kumar sir. Yes, sir. Thank you, sir. Thank you for a wonderful longest session of this e-conference. No, sir. It's like that much information is needed to guide our physiotherapists to go in the right path. Otherwise, what Narasimman sir told, that we post videos of percussion and vibration, which is harming the community. Likewise, they may have a lot of doubts that COVID patients having diabetes, having hypertension, any other neurological conditions. So it was needed, sir. That's why we have not stick to that scientific session timing, standard timings, just 20 minutes or 15 minutes. No, it is not going to work that much, because we have more than 1,000 registered participants and more number of subscribers in our YouTube channel also. If they are missing it now, they will watch it later. That much I know that. Those whoever wanted it, they will search. Otherwise, they will ask for the link and they will watch it again. Every session, actually, not only one session. So it is helpful for us. And even in future, if there are any doubts, they can go through all the links and they can learn much. And thanks for supporting us, sir.
Sure, Chandramohan.
So you are not audible.
Sir, you are not audible.
I'm not audible, sir.
Yes, now we can hear you, sir.
Is it?
Yes, sir. We can hear you now.
Yeah. No, as we are able to see that from previous conferences also, that always you put hard work and always try to give best to our participants. And as we know that we initially planned for a different topic, but but I think it's also good that the topic that you have given now with comorbidities, I think it was very appropriate. And as I discussed with, I will take one day time, and I felt that it was really a good topic, and it was I was actually learning many points out of it, and I was able to apply many my experiences also. Okay, because like many of us are going through COVID, I also have experienced that. So I was able to really appreciate the difference in the outcomes of people, whatever we are hearing from news channels and other things. But when we see the patients actually like diabetes and hypertension and post-COVID, how much complication they do develop, and that made interesting for me also to gather the information for the presentation. And I hope this conference has served the purpose, and it's all because of your good effort, hard work, and your approach, as madam was talking, that the humble approach that always there with all the team members. And I congratulate definitely, as we know that behind the screen many people are working, and I think I should appreciate the student participants, and there are some graduates also who have volunteered from India and abroad. It's a great work, and also it indicates that how far your conferences and information has reached, so that people are volunteering abroad India also. Okay, so that shows it's really thing, and I'm very happy that I got an opportunity to be associated with it. I think this should be an pride for us to be associated with you to do this knowledge sharing with our students. Thank you, sir. Thank you so much. Thank you, Duna ma'am, and thank you, Rupesh sir. Okay, all the best. Good luck. Thank you.
Thank you, sir. Stay connected with us. There are certificates for all the resource persons too, but we will show one by one. We are giving priority to volunteer because for 2 days they have stayed in front of the screen. So we wanted them to be presenting here with happy face. Can we go for the next participant? Sorry, volunteer certificate. And I can see Rajisha madam. I'm going to call her next.
Anishka is there? Yes, she is there. Yeah, this certificate is for you.
Thank you, ma'am. Thank you so much. I'm so happy to be a part of this.
Thank you, Tanishka Sengupta.
Thank you, sir.
Thank you so much. Yeah, and thank you every volunteers. Once again, I'm telling you, with every certificate also, wonderful job done. Kindly accept our certificate of appreciation.
Yes, sir.
Yes, please move on to the next certificate. Okay, meantime, I will call.
Rajisha madam is there.
Yes, Rajisha madam is there. I call upon Dr. Rajisha. Please, madam.
Hi, sir. Wrapping out with a very good topic, very good speaker.
Actually, many of the topics that we discussed and made, you know.
Yeah.
Prem sir gave some topics. Narasimhan sir gave some topics, and Amali sir gave some topics. Then we sat for more than an hour to discuss for the topics itself, to frame it, to give
How to frame it was a
Yes.
difficult task given
Yes.
to me.
Yes.
So I really hope your work for the community of physiotherapy is well recognized, and I think special thanks to Duna ma'am. Duna ma'am should next appear for RGHS last examination. Probably she'll score the best because she's been through our webinars. She's been through us for our conferences. Everything, she is there on ground. She'll be knowing so much about physiotherapy. So thank you so much, ma'am. And Rupesh, you're always wonderful. I'm really humbled and I'm happy to be a part of such esteemed speakers. I hope I have done my part. I'll be always there, as you know. I'll be always there to help you go forward, whatever it is, whichever. Okay, you want video? I'm not really ready for that. Okay, I just went out and came. So yeah, definitely yes. Anything going forward, I have full faith in you. Not only you, sir, in the Trimurtis, I would like to call. Whatever topic, please let me know. I'll be there with you guys, especially CRPT and gynecology. I'm telling CRPT because you are getting confused me, confusing me with OBG specialty. I am CRPT with OBG, so please do consider that also.
Sure, madam.
Thank you
Sure.
so much, sir. You have done a wonderful job. Thank you, RX India. And I thank all the wonderful speakers for sharing their knowledge and their time with us, so that we'll have an informed practice. Thank you so much, sir, and congrats on successfully completing Covicon 2021.
Thank you, madam.
Thanks a lot,
Thank you
ma'am.
for support. And even whenever we need help, we approach you and you never said no. Thanks for that, actually.
Definitely, sir. I'm always there. Please let me know. It's wonderful. It's a noble profession. It's a noble profession, both teaching as well as physiotherapy. So both together, I'm happy to do anything that I can from my side, along with the EXRS. Thank you, sir.
Convey our team EXRX India regards to your team, madam.
Sure. Definitely, I will. I think Shankar Ganesh sir has already told that the whole team is being put up and things, so they are pretty happy, I guess.
Yes. Madam.
Okay,
Yeah.
sir. Thank you, sir.
Thank you, madam. Thank you so much.
Thank you.
Ish, can you put next certificate on screen?
Yes, sir.
Please.
Can you find the certificate, sir? Miss Tusha
Yes.
Ganesh Shaurashya.
Yes, sir.
Yeah,
thank
she
you
is
so
available.
much, Miss Tusha Ganesh Shaurashya. Come on, camp, please.
Thank
Kindly
you so much, sir.
Yes, she joined camp, sir.
Thank you so much, sir.
Thank
It
you.
was very informative session. Thank you so much. Thank you, ma'am.
Yeah, thank you.
Happy to present you that.
Yeah. Yes, join.
Can I go next, sir?
Yes, please.
Sir?
Go fast.
Mr.
We
Divyam
are calling
Sharma.
upon. Yes.
If you are available, you can come on the cam.
Hello, am I audible?
Yeah, you are audible.
Yes,
but,
Divyam, you can join camp if you want.
Yes.
Yeah.
Thank you so much, Divyam Sharma, for the help.
Thank you so much, sir.
And kindly accept Team EXRX India's appreciation certificate for you.
Yes, sir. Thank you so much for making me a part of this whole session, because I had learned many things from this session. Like not only about the topics, not only related to studies, but how to manage things. Like I managed on YouTube and other things. So thank you so much, sir.
Thank you so much. Move on to the next certificate, please.
Can we speak to Arun sir in between?
Next is Mr. Gokul
He
Prashant.
just messaged in chat box.
Yeah, later. Next certificate is coming. Arun sir, I spoke already. Let us see how we can ask for his experience in the government hospital. Be ready, sir.
Yeah, Gokul Prashant, if you are available, you can come on the cam. Then I'll move on to the next, sir.
Yes.
Mr. Pagila Ankit Reddy.
It is not shown here. Here it is showing Divyam Sharma.
Divyam Sharma.
Yes, please.
Yeah, Ankit Reddy, I will be showing it, sir.
Yeah. Thank you, Ankit Reddy, Mr. Pagila Ankit Reddy. Thank you so much for volunteering for past 2 days. Thanks for your help. Kindly accept our certificate of appreciation.
Thank you, sir. Thank you for making me part of it.
Welcome, most welcome. Rupesh, please go to the next certificate.
Mr. Ravi Kumar, if you are available, you can come on the cam.
Hello.
Yes, he's there.
Thank you
Thank
so
you,
much, sir.
Mr. Ravi Kumar, for a wonderful job done, and kindly accept our certificate of appreciation, please.
Thank you so much, sir, for making a part of this.
You are always welcome. Thank you.
Mr. Swaminathan, if you are available, you can receive your certificate. So can you view Mr. Swaminathan's certificate?
No, it is Ravi Kumar's.
Yeah, Swaminathan, if you are available, you can come.
Swaminathan is there. His video
Yes,
is
he has joined video.
Yeah.
Unmute, please, Swaminathan.
Thank you, Mr.
Unmute and speak,
Swaminathan.
please.
And there are he is having own team actually. He came up with the 6 of his friends. So we were much more cool, and we didn't know who has helped him. At last session only, before last session only, he gave the name for volunteers. There were 6 members in it. Thank you so much.
Thank you, sir. Pleasure is ours. Nice to have a great opportunity with you and your teams. Such a great experience for us in these 2 weekends at this pandemic time. I would like to say thanks to my Bobby ma'am, our staff. She asked us to join. Either you are a participant or a volunteer, you must join. She advised and guided us to be here. And I must say thanks to her on this panel, sir. And nice experience. Thank you, sir.
Thank you so much. Convey our regards to Dr. N and Bobby, madam.
Next, Ms. Arbuta, if you are available, you can come and collect your certificate. Ms. Arbuta. Ma'am, can you view Ms. Arbuta's certificate?
Yes, I can see.
Ms. Arbuta,
I'll move on to
please come again.
Next. Ms. Archana, if you are available, you can come and collect your certificate.
Kindly accept
Archana, you there?
India. Yes, okay, they are not here. Move on.
Yeah.
Yes, sir. Thank you so much for making our weekend as like such a great conference. And thank you so much, Chandramohan sir, to allowing me as a volunteer for this grateful session. So thank you so much, sir.
Okay. Thank you for the help. Kindly accept our certificate of appreciation. You are always
thank you so much.
Yeah.
Next is Ms. Abhinaya A.
She is not here, I think. Yeah, we can check in.
Did we present to M. Satya?
Satya there?
Baby Lata is there.
Baby Lata, Satya.
Baby Lata is next, sir. If Baby Lata is available, you can come, Baby Lata.
Yes, she's there. Baby Lata?
After Baby Lata, Satya can be ready.
Baby Lata?
Yes, she joined. Yes, she's there.
Thank you so much, Ms. Baby Lata. for your wonderful
Yes, sir.
job.
Thank you. Thank you so much for.
Kindly accept our certificate of appreciation.
Yeah, sir. Thank you. Thank you so much for the opportunity.
Most welcome. Most welcome.
Thank you, sir.
Welcome.
Thank you so much for the opportunity.
Yes,
Thank
please.
Next is M. Satya. Satya, you there? Yes.
Thank you so much, Ms. M. Satya, for your help of taking attendance continuously for 2 days. Kindly accept our certificate of appreciation to you. Thank you.
Anyone left?
Mr. Shubha, if you are available, you can collect your certificate.
He is not here. Shubha is not here.
Not there.
Next is Miss Maria Ginoy.
No, she is not here.
No, I think the people are here. We have already presented to them.
Yeah, sir. I'll just do only 2 more.
Yes, you just show once.
Yeah, you just show it. Show it.
Miss
You just show
Jaypriya
once.
and Miss Lavanya are the remaining participants.
Dear volunteers, kindly accept our certificate of appreciation to you. We appreciate your work. We value your time rendered
Jaypriya.
for attendance. And Miss Jaypriya, JPK, kindly accept the certificate of appreciation from us.
Next is Lavanya, sir.
Yes. Miss Lavanya, kindly accept our certificate, please. And we will be sending it to you through mail or WhatsApp. Kindly save the certificates. Don't miss it because we don't keep this data in our database.
Almost 21 volunteers were helped for us, sir, and we have appreciated them with our gratitude of help certificate.
Yeah. Now the time for showing who is here, and we are having Senil Kumar sir. So kindly show Senil Kumar sir certificate, please.
Yes.
Once again, I welcome Senil Kumar sir. Go for full screen, madam.
It is PDF file, sir.
Okay, okay. Sir, kindly accept our.
Thank you, Chandramohan sir and your team. I think it's a good job. It's a great work. I think you will keep going and fly with new colors. And it's a great opportunity for us and as well as the participants to gain a deep knowledge. Okay?
Yes, sir.
It's a good job. And again, a special congratulations to the volunteers, the budding physiotherapist. And it's very interesting to know that you have engaged the students in a good planned manner.
Yes.
As one of the students was mentioning that he was able to learn the management techniques, which is very well important in this scenario. Okay, thank you for that. And thank you for the opportunity. All the best. Thank you.
Yes.
Our pleasure, sir.
Among 1,200 participants, more than 1,000 are graduates, and we restricted students, sir, because many of them may not understand, but we have some other plan for them. In future, we are going to conduct something for the students also.
Yes, sir, sure. So that will be helpful for the students. Thank you.
Yes, sir. Yes, sir. Thank you, sir. Thank you. Kindly accept our certificate of recognition, sir.
Thank you so much. Thank you.
Yes, sir. And now I call Reshma madam, Dr. Reshma Parveen.
Yes,
Yes,
just opening
hello.
it.
Yes, madam. Thank you for being here now.
Thank you.
And kindly accept certificate.
Thank you so much. Thank you so much. It has been a great opportunity, a great pleasure to be associated with such a nice conference. Thank you so much, and looking forward for more as a participant also now.
Sure,
Definitely
madam.
as a participant also. Very well done. Thank you so much, and keep it up. Congratulations to all of you. Thank you. Thank you so much.
Yes, madam. Once registered with EXRX India, we keep on torture our registered participants for sending links. So don't worry, you can get so many links from us.
It's not a torture. It's an opportunity.
Yes, madam.
Thank you. Thank you.
Thank
so
you,
much.
ma'am.
Please
Thank
spam our own WhatsApp group.
Thank you. Thank you, Duna. Thank you very much.
Yes, madam.
Thank you, ma'am.
Welcome. And Rajisha madam, she's not there. And we gave certificates of all. And once again, I thank all on behalf of EXRX India team and on behalf of Dr. Prem Venkateshan, though he is staying out, but he is with us in every things we do. On behalf of him and on behalf of all resource persons and on behalf of all volunteers and on behalf of all Indian participants, there were participants from 10 more countries. Through this conference, we have reached Netherlands. From physiotherapists from Netherlands also registered for this. So it's like earlier we have reached 30 countries, now it is 31. Thank you, Netherlands, and thank you all other countries who always support us. And thanks to Hiba from Lebanon who supported us by volunteering. And I thank everyone. I think, Rupesh, are you ready for the national anthem?
Yeah.
National anthem.
Yes, sir. Yes, sir.
Yes.
Share it, please.
Request all to stand up wherever you are. So now national anthem is going to be played. So
1 second, sir.
Before that, you get kept ready, sir. Arun sir, I promise that I will be asking you the experience, your experience. You can share any bits or tips or pieces you have seen. You are in a government sector and you can share something, sir, if possible. Arun sir, are you there? Yes, sir. Okay, Arun sir is
Yeah, sir.
Not ready. I think he is there, but the link maybe he is not available on the other side. Yes, are we ready, Rupesh?
Yes, sir.
Yes, please play. Please. Thank you so much. Thank you all the distinguished speakers, and thank you volunteers once again, and thank you all team EXRX India. Thanks everyone. Bye bye all. See you all soon with some other best programs. Take care, stay safe, stay home, and stay online with EXRX India. Thank you all. Bye bye. Bye bye, Arun sir. Bye bye, Prem sir. Bye bye, Sendil sir. Bye bye, volunteers.
Bye, sir. Bye, bye.